Have you ever heard of pulmonary Langerhans cell histiocytosis? Sounds complicated, right? Well, let's break it down. This is a rare disorder that primarily affects the lungs. Its name gives us some clues. Pulmonary relates to the lungs. Langerhans cell is a specific type of cell in our immune system, and histiocytosis refers to an increase in the number of certain types of cells. In this case, it's a disorder of myeloid dendritic cells, a fancy way of saying that a specific type of immune cell is misbehaving in the lungs. So, in simple terms, it's a lung disease caused by a specific type of cells gone rogue. You may wonder, how do doctors diagnose such a complex condition? Well, the process typically involves a two-step approach. First, imaging tests such as chest X-rays or CT scans are used to spot abnormal growths in the lungs. These tests provide a detailed view of the lungs, helping doctors identify any unusual areas. However, imaging tests alone can't confirm a diagnosis of pulmonary Langerhans cell histiocytosis. So the second step is a lung tissue biopsy. This is where a small sample of lung tissue is removed and examined under a microscope to detect the presence of Langerhans cells. Although it's a complex process, accurate diagnosis is crucial for effective treatment. What are the signs and symptoms of this condition? How would you know if you have it? Well, the symptoms of pulmonary Langerhans cell histiocytosis can vary greatly from person to person. However, some common signs include shortness of breath, persistent cough, and chest pain. Some people may also experience fatigue or unintentional weight loss. These symptoms often become more pronounced over time, leading individuals to seek medical attention. It's important to note that these symptoms are not exclusive to this condition and can be caused by a variety of other health issues. Remember, these symptoms can also be caused by other conditions, so it's important to consult a healthcare professional. So how common is pulmonary Langerhans cell histiocytosis? Let's dive into the epidemiology. It's important to note that this is a rare disease, not something you hear about every day. Typically, it affects individuals between the ages of 20 and 40, striking in the prime of their lives. It's a stark reminder that even rare diseases can have a significant impact on our society. Though rare, it's a condition that can affect people in the prime of their life. Are men more prone to this condition than women, or is it the other way around? When it comes to pulmonary Langerhans cell histiocytosis, the incidence rate is fairly low, making it a rare condition. It's estimated to affect between 1 to 2 individuals per million. Now let's talk about the male to female ratio. Research indicates that the disease strikes men and women with almost equal frequency, showing no significant difference. So regardless of gender, anyone could potentially be affected. It's clear that this disease doesn't discriminate based on gender. What's the survival rate for people with pulmonary Langerhans cell histiocytosis? What can they expect in the long run? These are significant questions, aren't they? The survival rate for individuals with PLCH can be quite variable, depending on several factors, such as the stage of the disease at diagnosis and the effectiveness of the treatment received. In general, it's important to note that PLCH is a rare, complex disorder, and its progression can be unpredictable. For some, the disease may stabilize or even regress over time, while for others it may progress more rapidly, leading to serious lung damage. However, early diagnosis and appropriate treatment can make a substantial difference in improving the prognosis. This might involve therapies to manage symptoms, halt disease progression, and in some cases, lung transplantation for those with severe disease. The journey with PLCH can be a challenging one, but remember, despite the challenges, there is always hope with early detection and appropriate treatment. Pulmonary Langerhans cell histiocytosis is undoubtedly a complex condition. From its definition to its diagnosis, it's a condition that challenges our understanding of health and disease. We've explored its signs and symptoms, learned about its epidemiology, considered the incidence rate and the male to female ratio, and pondered over survival and prognosis. It's clear that the landscape of pulmonary Langerhans cell histiocytosis is vast and varied. The more we understand about conditions like this, the better equipped we are to fight them. So stay informed, stay healthy, kijk. Oishiti konfo. Like and share. Gyan kuwu subscribe.